First of all, could you introduce yourself and tell me who you are?
My name is Hendrikz. I'm a consultant in transitional metabolic medicine, which is an unusual term because I really look after the transitional care, so that's patients going from the pediatric service to the adult services. And I'm based at Salford Royal, which is one of the adult reference centres in the United Kingdom. My main research interest is in the MPS and related diseases, although my clinical interest is across the whole field of rare inborn errors of metabolism.
And for how long have you been doing this?
It's a long-winded question, but I think the easy answer is about 18 years because I come from a sports medicine background, so actually we did some of that as part of sport medicine already.
Could you summarize where your talk is about?
So my talk is really about how do we transfer young people from a pediatric service into an adult service. And the main issues around these are many of the adult services does not have the facilities or the knowledge really to manage these patients. So as a pediatrician, I've now moved to an adult centre and I facilitate the process because I have done some adult training as well. And the whole idea is that now it will be easier for families to move from the pediatric service to the adult services.
I think it's a new concept. Do you know if it's here in Holland also some sort of concept like this?
I'm fairly sure many people are talking about transition care, and there are different models of transition care. The one which most people use is what we call a push model, and that means the pediatric services push the patients out to the adult services and there is a break in between, so there's no continuity during the transition process. Where the model I'm working in is what we call a pull model. That means somebody who's in the adult services actually goes to the pediatric service, spends a few years with a patient in the pediatric service, then brings them over to the adult service, stays with them for another few years, make sure they integrated into the adult services, and then only release them into the full-blown adult world.
Where do you think the future will bring us?
One of the challenges is that very few of us has got the ability to actually look after both adults and children at the same time, because in the pediatric services we've got a lot of knowledge about the management of the specific rare disorders, but once you start looking at the adult-based disorders, so heart disease, osteoporosis, diabetes and the cancer, the other risks which comes in, we don't have that knowledge as pediatricians. So now you have to suddenly be an expert pediatrician as well as an expert adult physician at the same time. And it's now the whole learning process is to see if we can develop a new group of people who actually can look after that group of patients. So ideally, I believe it's somebody that's going to be looking after patients between the ages of about 12 and 25 years of age.
How do you like the conference so far?
I've really enjoyed it. It's always a fantastic opportunity to meet my colleagues, see many patients, interact with many of the families, and the quality of the science and the interaction with all the other professionals together with the families gives a huge and such a nice mix of the conference, and which is why it's one of my favorite meetings every year.